discuss here in this video the trigeminal nerve. The sensory information from the body is carried to the thalamus by the medial lemniscus and by the spinothalamic tract, and from the face and oral cavity mainly by the trigeminal nerve. Also, sensation from parts of the mouth, parts of the ear, and parts of the meninges is carried by the cranial nerves 7, 9, and 10. All sensory fibers from these nerves they terminate in the trigeminal nerve nucleus. The trigeminal nerve supplies the front of the face. What's the nerve supply to the back of the head? It is supplied by the posterior cervical nerves. The posterior cervical nerves on the back of the head and the trigeminal on the front of the face. What's the area of distribution of different sensory branches of the trigeminal nerve? See, the ophthalmic nerve supplies above the upper eyelid. And what's the upper limit for this? Ophthalmic division is as far back as the vertex. But its lower limit is on the nose. It supplies to the skin of the nose also via the infratrochlear and the external nasal branches of the ophthalmic division of the trigeminal nerve. The ophthalmic division, although it supplies to the nose, but it doesn't supply to the alley of the nose. So what's the nerve supply of the alley of the nose? It's supplied by the maxillary division. Where does the maxillary division supply? From the lower eyelid to the upper lip. That's the area which is supplied by the maxillary division along with the alley of the nose. And where is the supply of the mandibular nerve? It's below the lower lip. And what's the upper limit of the mandibular nerve supply? It's in front of the ear. A narrow strip goes up to the ophthalmic division here above by the temple. Which part of the ear is supplied by the trigeminal nerve and which branch? The tragus and the upper part of the lateral surface of the front of the external ear is supplied by the auriculotemporal branch of the mandibular nerve. The ear is mainly supplied by the greater occipital nerve on the medial and lateral surface, including the lobule. The root value is C2 and C3, whereas a lesser occipital nerve, which has a root value of C2, supplies the upper medial surface of the ear. The 7th and the 10th cranial nerve have lateral and medial surface supply in the center. What's the nerve supply of the external auditory meatus? Anteriorly, it's supplied by the auriculotemporal branch of the mandibular nerve and posteriorly by the vagus nerve. So 5 and 10. Anteriorly by the cranial nerve 5, trigeminal, and posteriorly by the vagus nerve. So what's the nerve supply of the angle of the mandible? The angle of the mandible is not supplied by the mandibular nerve. It is supplied by the cervical 2 and 3. Which of these sensory divisions they lie in the cavernous sinus? The ophthalmic and maxillary division of the trigeminal nerve they lie in the cavernous sinus. The other cranial nerve that pass through the cavernous sinus are oculomotor, trochlear, and abducent. And what's the nerve supply of the sensory nerve supply of the tongue? It's the anterior 2/3 is supplied by the mandibular division of the trigeminal nerve, and the posterior, what's the nerve supply of the posterior 1/3 of the tongue? The posterior 1/3 is supplied by the glossopharyngeal or the 9th cranial nerve. How do they enter the cranial cavity? The ophthalmic division enters through the superior orbital fissure. The maxillary division enters through the foramen rotundum, and the mandibular division enters the cranial cavity through the foramen ovale. And then these nerves unite to form the Gazarian ganglion or the semilunar ganglion. The semilunar ganglion lies at the apex of the petrous temporal bone. What's the Gazarian ganglion? It lies at the apex of the petrous temporal bone and is analogous to the dorsal root ganglia of the spinal cord, which contains the cell bodies of the incoming sensory fibers from rest of the body. How many nuclei of the trigeminal nerve? There are three nuclei of the sensory division of the trigeminal nerve: the mesencephalic nucleus, the main sensory nucleus, and the spinal nucleus of the trigeminal nerve. And where is the motor nucleus of the trigeminal? It is adjacent to the principal sensory nucleus of the trigeminal nerves. Where is the mesencephalic nucleus, the principal sensory nucleus, and the spinal nucleus? The mesencephalic nucleus is in the midbrain, the main sensory nucleus is in the pons, and the spinal nucleus in the spinal cord and the medulla. And what sensory information do these nuclei carry? The mesencephalic nucleus concerned with proprioception. The main sensory nucleus is concerned with the touch, and the spinal nucleus carries pain and temperature sensations. See here, after this, the nerve fiber, they go to the thalamus, they cross over to the opposite side and they relay in the thalamus, and the third then from there on to the somatosensory cortex for the face. Which of these nerves are pure sensory? The ophthalmic and the maxillary divisions are the pure sensory nerves, whereas the mandibular division is a mixed nerve which carries the motor fibers to the muscles of mastication. Which muscles does the mandibular division supplies? The mandibular division, which is the mixed nerve, supplies the muscles of the which develops from the first pharyngeal arch. These are the 8 muscles. 4 of them are the muscles of mastication: the temporalis, the lateral pterygoid, the medial pterygoid, and the masseter. The other 4 muscles that are not muscles of mastication are mylohyoid, the anterior belly of the digastric, tensor palatine, and tensor tympani. So what's the nerve supply of the posterior belly of the digastric? As the anterior belly is supplied by the trigeminal nerve, but the posterior belly of the digastric is supplied by the facial nerve. Injury to the peripheral nerves of the muscles of mastication can cause paralysis of the muscle on one side of the jaw, with the jaw deviating towards the paralyzed side when it opens. What are the trigeminal nerve reflexes? There are 4 trigeminal nerve reflexes: the corneal reflex, the tearing or the lacrimal reflex, the jaw jerk, and the oculocardiac reflex. What are their afferent and efferent limbs? For the corneal reflex, the afferent limb is carried by the ophthalmic division of the trigeminal nerve, but the efferent limb is carried by the 7th cranial nerve, the facial nerve, which causes contraction of the orbicularis oculi T-con to cause a blink. The tearing reflex, the afferent limb, is also carried by the ophthalmic division, and the efferent limb is also carried by the 7th cranial nerve or the facial nerve. So in both corneal reflex and tearing reflex, the afferent limb is by the ophthalmic division and the efferent limb is by the facial nerve. In the jaw jerk, the afferent limb is by the mandibular division, and the efferent limb is also by the mandibular division, the motor part. The afferent limb goes to the motor nucleus of the trigeminal nerve, and then from there on, the motor nerve that brings the information causes contraction of the masseter to cause the jaw jerk. Whereas the oculocardiac reflex, the afferent limb is by the ophthalmic division, and the efferent limb is by the vagus, the 10th cranial nerve. So what's the oculocardiac reflex or its effects? Pressing over the eyeball decreases the heart rate. How? By slowing the AV conduction due to the vagus nerve stimulation. Why keratitis develops in a cranial nerve 5 or trigeminal lesion? It is the sensory to the lacrimal gland or the tearing reflex we just discussed, and is in close proximity to the facial nerve fiber that supply the parasympathetic secretomotor fibers to the lacrimal gland. Supply of the teeth. The upper teeth are supplied by the superior alveolar nerve, which is a branch of the maxillary division, and the lower teeth are supplied by the inferior alveolar nerve, which is a branch of the mandibular nerve.